Today, on this episode of The Crossover, we will be discussing NFL player health and safety with NFL Chief Medical Officer Dr. Alan Sills. Find out how the NFL is making America's most popular sport safer for its athletes. Much more on this episode of The Crossover. So today, everyone, we have the pleasure of speaking with my good friend and colleague, Dr. Alan Sills. As background, Alan is NFL Chief Medical Officer and Professor of Neurosurgery at Vanderbilt. As NFL CMO, Alan is dedicated to advancing the health and safety of the sport of football. As background, prior to joining the NFL, Dr. Sills served as a consulting neurosurgeon for the NBA's Memphis Grizzlies, the NHL's Nashville Predators, the U.S. Equestrian Foundation, and Vanderbilt's athletic programs. Dr. Sills has published over 170 scientific articles, including 40 in the last 5 years on the topic of sports concussion. He's also a member of Concussion in Sports Group, the American Board of Neurological Surgeons, and the American College of Surgeons. And on a personal note, I've had the privilege of knowing Alan now for a while. He is not only a fellow graduate of the Johns Hopkins School of Medicine, but also a nationally recognized brain tumor expert with an incredible reputation here in the academic community. I was shocked to know that he's still very busy clinically on top of being the NFL Chief Medical Officer. So super excited to talk to you today, Alan. Great to catch up. And we're here to talk about NFL player health and safety. So welcome.
Hey, thanks for having me. I appreciate it.
So let me just start with kind of the obvious question, right? NFL players are getting bigger, stronger, faster. People love the gladiator aspect of football. They love the contact. How does your committee balance player safety with what makes the sport so great and so popular?
Well, I think it really starts from the top. And, one of the things that our commissioner, Roger Goodell, is fond of saying is that the game of football can be made both safer and more exciting. Those are not mutually exclusive goals. And I certainly embrace that line of thinking as well. And I think we've seen that evolve. If you think back 10, 15 years ago, for example, there was a show once a week that showed the biggest hits in the game, where guys had head-to-head contact and there's thumping rock music and everybody saw it and it was really glorified. And today, when I show those types of hits on video to medical audiences, to lay audiences, to anybody, everybody sort of goes, "Oof, man, I don't want to see that." That's an illegal hit. And so I think that just shows this evolution of how we've evolved the way we watch the sport as fans, and certainly the way we think of it as coaches, players, everyone affiliated. So I do believe that there's been a substantial cultural change that's really taking into mind how we can make the game safer while still preserving all the parts that are exciting.
Now, this has really come to a head in the last 10, 15 years. I mean, NFL was always interested in player safety, but particularly in the last decade, it's become such a huge priority. And what really triggered it? Was it science? Was it evidence? Was it a sentinel event? In your opinion, what kind of triggered this huge push for player safety?
Well, I think there are a number of things that have led to that. I mean, I think first of all, we do have much better data than we've ever had before, and so we can more comprehensively understand injuries and not only understand how they're, how many are occurring, but how they're occurring and what we can do on the prevention side. And I think there again has been a real cultural change away from this idea of, well, that's just football, there are going to be injuries. I think we no longer accept that and say, no, that's not how we look at this. We look at any sport, whether it's football or soccer or lacrosse or rugby or whatever that may be, and say, there are obviously always going to be some risk for injury, but what can we do to really lower that, to mitigate it, to get it to be as low as possible? And we in the NFL and the health and safety side, we're really driven to keep lowering those targets because we believe there's always more that can be done. Whether we're talking again about concussion, lower extremity injuries, ankle sprains, whatever we're talking about, we think that as we better understand, characterize these injuries, understand more about training and performance, we think we can drive them down. And by the way, that's not that different than what you and I do in medicine. I mean, let's say 15, 20 years ago, we had a very different idea about outcomes from brain tumors or spine surgery, things like that. It's taken people pushing those limits and saying, no, we can do better. We can lower the morbidity or the invasiveness of this procedure, and we can improve our outcomes. So I think you're seeing that same paradigm applied to sports medicine.
Yeah, such an interesting kind of analogy, because certainly medicine, as people kind of refine their skills, as they have more experience, what was tolerable before as an okay outcome is no longer tolerable, just like you were saying, and the bar has moved up. So that's a great analogy.
I don't think people appreciate the level of science and data that goes into NFL player safety. Can you just give us a little background of the type of research that's being done in terms of type of equipment and officiating?
Well, we actually do a ton of research. In fact, people are often surprised. I didn't know this before I joined the NFL. People are often surprised at how much research the NFL does. If you look back, for example, over the past 6 or 7 years, we funded $250 million, over $250 million in research funding externally that we've done across a variety of topics. Everything again from concussion, long-term outcomes to pain management to musculoskeletal. But in addition to that, we look a lot at our own game, at our own data. And that's a place that's really one of the most fun parts of my job. So all 32 of our clubs report to the same electronic health record. They all put everything in the same EMR. That doesn't go to the league, but it goes to a third-party company, an epidemiology and data science company called IQVIA, and they can extract all that injury and illness information and bring it back to us in anonymized aggregate form. But in addition to that, we know so much about player participation. Every player, for example, wears a GPS chip when they're on the field, so we know who's moving where and at what speeds. We track equipment. We've got every helmet tagged. We've got cleats tagged with RFID tags, so we know who wears what equipment in all those situations. And then, of course, we have video, enormous amounts of video from every angle, as well as medical reports from our independent personnel, our spotters on game day, our unaffiliated neurotrauma consultants. So you take all of those data inputs, and now you can really start to comprehensively understand injuries, how they're occurring, what's driving them, where they're occurring, and really start to think about the biomechanics behind it. And you mentioned equipment. I think that's one of the real early wins for this whole approach is on helmet design. Our engineers that we work with, a company called BioCore, took all of this data and said, we believe we can build better helmets. And so they created actually a finite element model of how concussion causing collisions were occurring, gave that model back to the manufacturers and said, this is what we need to design against these specifications. And as such, helmets have progressed dramatically over the last 5 to 7 years. And we've seen a concussion reduction as a result of that. So that's, as I said, one of the most exciting parts of my job is being able to see all those different data inputs come together for the benefit of things like better equipment design or play design. You mentioned officiating. It's also driven some rules changes to have that degree of insight into injury.
Now, people always focus upon concussions. CTE is obviously the big long-term worry. Give us some numbers. How have concussions in the NFL decreased over the last 5 or 10 years? Do you have hard data, or maybe you don't on you, but just roughly?
Yeah, no, so I do have that. So, in 2017, which was the year I took this job, we had an all-time high number of concussions in the NFL, most we've ever had in any season. I always say that was kind of my housewarming present, right? Here you go, brand new job. And we really went at that and said, that's a call to action. We've got to do something about that sort of wave. And we went and dug in again to the data, worked really closely with the Players Association, with the engineers, with the epidemiologists, biomechanists, and kind of designed a concussion reduction plan and said, we believe if we do a couple of things that we can lower this. We focused on contact and preseason and where preseason concussions were occurring. We focused on helmets and better technology and getting players in safer helmets. And then we focused on some of the rules, and we made some rules changes around the kickoff and how we line up and do that. We got rid of the blindside block. And we also put in this rule about lowering the head and initiating contact with the helmet, if you remember. So all those changes came in about 2018 or so. And we saw an immediate drop, 25% drop in the number of concussions. It went down immediately. And we've sort of sustained at that level. Last year in 2021, we had the lowest number of concussions we've ever had in a season. And wow. That's despite adding a 17th game. So we had one more game, one fewer concussions than we've had. So again, the work is not done. By no means are we at the finish line, but I think that what we did see is when we apply this kind of paradigm to, understanding the injury and preventing it, we can in fact drive it down. And so we continue to challenge ourselves to make more progress there. But as I said, we're not just doing that for concussion. We're doing that around a whole panel of other injuries, lower extremity injuries, ankle sprains, knee ligament complex, strains, all of this. But obviously, as a neurosurgeon, I share a deep passion around the issue of concussion, and there's certainly more work to be done there, and that's something we're still working very aggressively against.
So, it is part of the game. It's obviously going to happen to some degree, no matter what you do. what is the current return to play protocol? And in your opinion, are we doing enough? Should it be even an even more stringent protocol?
Well, one of the things that I wanted to do when I came on board on this job was to really shed some light on our concussion protocol. I think sometimes people think that we write that on a napkin on an elevator someday, and that's it. But it's actually an extremely scientifically driven process. We have a whole committee of brain trauma experts called our Head, Neck, and Spine Committee. It's chaired by a neurosurgeon, Nick Theodore, and a neurologist, Javier Cardenas, who are experts in this area. And that committee meets multiple times during the year to revise that protocol and to really tighten up and use best data and science around how we diagnose and then return athletes to play after a concussion. And one of the things, again, we did is we published that concussion protocol. Back in 2019, we became the first professional sports league to ever publish our concussion protocol. When I say publish it, we put it through peer-reviewed literature, which, as you and I know, means it gets judged by a panel of experts to say whether or not it's good science. And we wanted to do that because, again, we wanted people to understand how much scientific rigor went into that protocol and how much annual review that we make. So we got that done, got it out there, and we've continued to iterate over year. That protocol is a recipe that says, how are we going to take care of anybody with a concussion? So it starts with diagnosis. It even really starts before that, baseline testing and screening. But then how do we pick up concussions on game day? And then once we diagnose a concussion, how do we return the athlete, as you mentioned, back to play? Every NFL player gets the same exact exam. So anytime there's a screen for a concussion, we have a checklist that's gone through. It happens the same exact way for every player, and it gets immediately documented. So we have an unaffiliated neurotrauma specialist there for every concussion eval. They've got a tablet or phone-based app, and they immediately record that. And so we get 100% return on those exams immediately, where we know how people were examined. Once a concussion is diagnosed, there is a progressive return to play. We've got a 5-step process that follows sort of, standard medical practice. And again, there are certain parameters that a player has to go through. In addition to that 5-step graduated return to activity, they have to be cleared by the team neuropsychologist, who does additional neuropsychological testing that compares back to their baseline. The player also has to be cleared by an independent neurospecialist, someone that doesn't work for the team, that reviews all the data and says, yes, I believe they no longer have concussion. And then they have to be cleared by the team physician. So they have to go through all of those different steps, the return to play process, the neuropsych testing, the independent doctor clearance, and the team doctor clearance to be brought back for final clearance. And I think that system works very well. If you look at the diagnostic part, there are fewer than 1% of all concussions that we don't detect on game day, meaning that they come in after game day. And as much as I'd like that number to be 0, it probably never will, because if you know anything about concussion, sometimes it's an evolving injury. Sometimes people don't feel symptomatic right away. So we look at that very carefully, but it's a very, very low number that is a delayed diagnosis. In contrast to that, something a lot of people don't realize, we do 3 or 4 concussion exams for every 1 concussion we diagnose. Meaning that on the sideline and on game day, there are way more exams that are done that are negative, that don't produce a diagnosis than our diagnostic for concussion. And we're actually okay with that number and that ratio. I think we in the Players Union feel like we want to have a really wide net. We want to make sure we're capturing anybody that might be injured. And then on the backside, you asked about return to play. We again look at how many players get brought back and then have another concussion during the same season. And that's been a very, very low number. And also just not something that we see happening sort of in the short term. It doesn't turn around and happen immediately, suggesting that we cleared people too soon. So we track all of those outcomes really carefully and are always looking to improve, but our numbers suggest we're doing a pretty good job on it at present.
Oh, that's great to hear. I mean, it's such a, because you always hear about that like repeat injury and what that can be. And so the fact that very few people who had a concussion have a repeat concussion in the same season, that's obviously, clearly you guys are doing something right. You had mentioned how the rules are so important, and you guys identified certain parts of the game that were higher risk for concussions, and you changed the rules, like you said, on kickoff and crackback blocks. Any other new rules in the future that you guys are potentially thinking about doing in order to reduce concussions?
Well, we always have a lot of active discussions around this, and it's discussions, not obviously just within health and safety, but we're discussing with officiating, with our football operations, with our coaches. One of the things people may not realize is that we have very frequent and direct two-way communication. So let me give you an example. When we changed the kickoff rule, we actually went and got with special teams coaches as a group, the people who coach this, and said, hey, here's what we're seeing on the play that creates injury. Here's where we see opportunity to change this. How might we change the play, still keep it exciting, and yet, address these concerns? And the coaches were an active participant in that process of, redesigning the kickoff play. So, I think that's the model we follow. So we're always looking at aspects of the play. I will tell you right now in 2021, it's no secret. I've said this in the media. The punt play is really under a lot of scrutiny. It is the most injurious play on the field right now, meaning it has the highest rate of injury. It's a complex play because it starts out as an offensive defensive play, right? You don't know that the team's going to punt. You got to defend against a fake punt. But then it transitions from an offense-defense play into a special teams play. There's a lot of space and a lot of speed. And so there are just a lot of factors that are driving injury. And we're really digging in and looking at that. We've been doing that for a number of months now. And so I would stay tuned about that one, because I think that's one where we really feel like we need to make progress based on what our data is telling us.
Yeah, I mean, I feel like anytime you've got people running 50 yards to gain speed, that play is always going to generate more injuries. I mean, it's just pure physics, right? I mean, just like a kickoff, the punt, when someone's looking up and they're kind of defenseless and someone's sprinting 50, 60 yards downhill at a 4.240 weighing 230. I mean, it's just, I mean, I would agree that that play clearly has a lot of injury potential. But where do you see the evolution going, right? People look back at the years of Jim Brown, right? And like running backs in that era were like 190 pounds. And now they're like 220 to 230, and middle linebackers are the size of nose tackles back in the day. So people are getting bigger, stronger, faster naturally. How do you combat that evolution? Like, where do you see this going in the future?
Yeah, I think it's all about better understanding, again, of the biomechanics around injury, and specifically training against some of the vulnerability. So, for example, our teams now do a lot more sophisticated screening of players, against certain vulnerability. They do motion screens and screens of certain movement patterns. And so, for example, we've got a study going on right now where we're using a motion capture system, a computer motion capture system, and looking at that and seeing how that might predict certain types of injuries or certain type of what we call pose, certain types of positioning on the field that we think lead to increased injury vulnerability. So I think that what we'll see is, over time, better specificity about how we train certain athletes. And let me give you for instance, you mentioned a minute ago, a guy running down covering a punt. So wide receivers, defensive backs, they're obviously in a certain pattern of motion, a lot of high speed sprint efforts, direction change, things like that. Very different from offensive defensive linemen, or let's say linebackers. So it's understanding what are the physiologic demands of each and really training a little bit more to that. I think we can do even more. Obviously, we don't train them all identically currently, but I think when you start to understand some of the expanded roles, for example, if you've got a tight end who also plays on special teams, is there some additional degree of training that you might want to do for that player to prepare them for that special team environment? So I think that's where we'll see is that there's going to be a greater degree of specificity around training and load management. That's a concept that, again, nobody talked a lot about in sports medicine, a decade ago. I think now we're better understanding, what types of factors lead to increased fatigue and lead to injury. How can we monitor those in real time and maybe modify loads, whether it be training load or game load, to reduce the risk of injury?
Has there ever been discussion of weight limits for positions, right? So, the scary thing is when you have a free safety that, again, used to be 190, 200, maybe 210. Now you got safeties that are 230. 235 coming in, getting a 20-yard head start, running a 4.340. Ever had a thought, I don't even know if it's possible, but restricting limits or weights at different positions on defense?
Yeah, I think, listen, we're looking always at all the factors that might be driving these injuries, and it's rarely as simple as you think. Let me give you an example. So most people would probably think, if we talked about hamstring injuries, for example, that most hamstring injuries occur because you've got somebody running at top speed, a receiver on a go route or somebody covering a punt play. And then boom, all of a sudden their hamstring pops or they pull it. But it turns out, as we've dug into the video on these injuries, that almost 60% of them have some degree of contact, direct or indirect contact. I think that surprises most people, right? That the hamstring injury may be more of a contact related injury than it is just high speed running. And so I use that as an illustration to say that it's rarely as simple as just weight alone. Well, a certain weight, if we were below that, we wouldn't have these injuries. There's just a lot of factors that go into it, that, again, I think you have to comprehensively study and understand, and then we share that data back. And again, at the end of the day, everyone wants the game to be as safe as possible, and we try to help coaches understand when are players vulnerable, what players are vulnerable, how do we put them in the best position to be successful and safe.
Now, what about dropping the number of preseason games? I know that the season's been prolonged by one game. Has there been thoughts of reducing preseason?
Well, we did last year. We cut back to 3 preseason games. So we went from 16 regular season, 4 preseason in 2020, and really for the past number of years. Last year, we had 17 regular season, 3 preseason games. So we looked at that. It turned out that total injuries did not increase. As I mentioned, some things went down. We had fewer concussions in the regular season than what we've seen before. So it's only 1 year of data. We have to continue to track that. But once again, I'll just tease and say it's a little more complex than you might think. It turns out that there's some data that participating in a preseason game reduces your risk of certain types of soft tissue strains in the regular season. Yep. In other words, there's something about reaching that competition level intensity that is protective when you get into the regular seasons, because we always see a little spike in soft tissue strains when we start the regular season. So, we just have to look at the full picture and think about what makes us safest. But I will tell you that is the lens that people are looking at this through, is, what does make the most sense for number of games and also timing. We look, for example, at how much interval between the last preseason game and the first regular season game. When do the bye weeks fall? How does that influence injuries? I mean, all of those things are things that we're really trying to look at with the goal of making the overall season as safe as it can be.
Now, what about non-game contact? Are there any league regulations with regards to the amount of contact drills or scrimmages teams can have, other than Sunday, or is that just team specific?
Very strict rules, as a matter of fact. So it's in our collective bargaining agreement that we only have 14 contact practices once the season starts, which surprises a lot of people that there's really very little contact. And so most teams are not having any contact practices after, mid-season, even sometimes earlier than that. So there are very specific rules about in-season contact. Even in the preseason, we have very specific rules about how much time can be spent in practice, how much time can be spent in contact, how many days in a row with days off, and that type of thing. So all of that is very, very tightly regulated. And it actually turns out, maybe surprising to most people, we have less contact overall in practice in the NFL than at any level of football. Certainly less than we see in college or even high school levels because of these restrictions that we have in.
Speaking about the youth and college and even high school, one question that always comes up, because typically the best NFL players start very early. Do you support kids playing football? At what age do you think they should play football? And what's your thought on youth playing football before they're adults?
Yeah, well, I get asked that a lot. And listen, first and foremost, I'm a dad, right? I have 4 kids. So I've confronted issues about sports participation with my children. I've been a youth coach. And so, again, looked at that. And then, of course, as a physician, I get asked about that outside of my role with the NFL. And here's how I answer that. First of all, as we said at the start of our program here, there are always some risk inherent with sports. But at the same time, there are a lot of benefits that sports provide. I mean, team sports provide a lot of benefits that has been well documented to health and overall well-being and mental health and a number of other factors. So to me, it's not a matter of good or bad, but the question again goes back to how do we make this as safe as possible? And as I've said earlier in our show here, I think that there are many things we can do to make sports safer, whether it's football, lacrosse, soccer, whatever it may be. Those things really fall into very well-defined buckets. So first, it's equipment. Do we have proper equipment? Do we have the right gear and the right fit that's appropriate for age and size and so forth? Secondly, what about the coaching and the techniques? How are we teaching people? I'll tell you another, for instance, in the NFL, we've banned what's called the Oklahoma drill or the bull in the ring drill, where you line up 2 guys in a circle and have them charge at each other and see who's the last person standing. That's not a football play. It's part of the culture of football from decades gone by, but it's not a football play, and it has an unnecessary rate of head contact. So there are things like that that you can eliminate in training, and how you teach the game has a lot to do with how safe it is. So how up to date is a coach about understanding that and understanding how we teach this and how, it can affect the rate of injury. And then lastly, what are the rules? Are there rules in this league? Again, whatever level we're talking about, are there rules that emphasize safety? Do we have appropriate personnel supervising? If it is contact, are there medical personnel available? Those are the key questions that I want to ask as a parent. Again, whether we're talking football or soccer or lacrosse, rugby, whatever it is, I want to focus on equipment, training and coaching, style of play, rules, and the medical support. And I believe that those things can be optimized. Again, you don't need to have the resources of the NFL. I've seen plenty of good leagues with volunteer coaches and dad coaches and parents who are running the league, and moms and dads who get out and help in these ways. But it's are they focused on safety? And in the same way, I would tell you, I don't think there's a magic age where you become 15 or 12 or 10, and all of a sudden now it doesn't matter, just go play. I mean, these same issues apply at any age. So long answer to your short question is, to me, it's not about a magic age, but it's about the environment. It's about the commitment to safety. And again, I don't think that's just a football issue. I think that's an issue across all sports. So I think kids can and should play sports, a variety of sports. Flag football is a great way to get introduced to football as well. And so I support kids who want to do all of those things. I just think it's on the adults and the league officials to try to make their league as safe as possible, whatever level and age we're talking about.
I totally agree. That's exactly how I feel about the topic. It's just good to hear it kind of verified from your level. As NFL CMO, what are your top 3 goals for this coming year?
Yeah, so one of our really big pushes now is not just concussion, but it's head contact. We've said that, yes, concussion remains important, but we also want to look at head contact. How many times are helmets being hit that don't lead to concussion, and driving that down? So we've now got ways we can quantify and measure that. As we measure that, we've stated very publicly, we want to drive that down. And I think there are 3 types of head contact. There's what I'd call intentional, which nobody defends, right? I'm going to intentionally hit a guy in the head. There's sort of unexpected or unavoidable, where players inadvertently collide or someone's head hits the ground. That's common to all sports. But then you think about that third category that's in the middle, that's sort of what we'd call avoidable. So how do we reduce and measure and get rid of that? That's a big goal. A second big goal of ours is around lower extremity injuries. We've targeted hamstring strains, soft tissue strains. They're our number 1 burden injury in the NFL. Players miss more time from that injury, hamstring strain, than any other injury. It keeps them off the field. And again, we believe there's some very specific training factors that go into that. We've had a lot of dialogue with coaches and clubs and sharing about that in ways that we think we can drive that down. And then we're also working very much on the knee ligament complex injuries and the foot ankle injuries, where there's a surface cleat interaction. Again, looking at interventions that can make a difference in those injuries, along with sort of training and screening methods. So those are the big ones. We've got a lot of other work streams, but those are ones that are a main focus of ours for the coming season.
Well, Alan, it's been half an hour. I know you're super busy. I'm going to let you roll. Such a great interview. It's amazing that you're able to keep the sport exciting. It's obviously the most popular sport in America, but you clearly have your hands full with the size of the players, the speed of the players, all the demands on keeping safety as a priority. But it's amazing what you've accomplished. The numbers clearly show it. And I still can't believe that you run a busy clinical practice. That's unbelievable. I'm not sure how you do it, but it's impressive.
Well, thanks so much for having me, and I appreciate the work that you do. You've had a great list of guests, and I'm glad to join that list, and look forward to maybe coming back in the future and telling you more about what we're doing here.
Absolutely. Always a pleasure. Thanks, Alan. Have a great weekend.
Thanks, you as well.
Take care, buddy.